Are your kidneys begging for help? As a doctor, I've seen countless cases where patients ignored early warning signs, only to find themselves dealing with severe kidney issues later. Our kidneys act as the body's natural filters, removing waste and excess fluids. When they don't function properly, harmful substances build up, leading to serious health problems. It's alarming that over 38 million Americans have kidney disease, yet only 10% are aware of it. This lack of awareness is partly because early symptoms often mimic other conditions, with the most severe signs appearing only in advanced stages. Therefore, early prevention and awareness are crucial. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "Great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. Sign 1. Shortness of breath. Did you know that breathlessness can be a sign of kidney disease? While it is commonly associated with heart or lung issues, shortness of breath can also result from compromised kidney function. When kidneys are not filtering fluids and toxins efficiently, these substances can accumulate in the lungs, making it difficult to breathe. This is especially problematic because the sensation of breathlessness is not only uncomfortable, but can also be alarming. For instance, I had a patient, Mrs. Nguyen, who came in complaining of severe shortness of breath. She initially thought it was due to her asthma. However, upon further examination and a series of tests, we discovered she had chronic kidney disease, CKD. The excess fluid in her lungs was causing her symptoms. After initiating dialysis, her breathing improved significantly. In addition to fluid retention, kidney disease can cause anemia. Anemia is a condition where your body does not produce enough red blood cells, which are crucial for carrying oxygen throughout your body. When your body is deprived of oxygen, you can feel extremely tired and short of breath. Anemia related to kidney disease is due to the kidney's reduced ability to produce erythropoietin, a hormone that prompts red blood cell production in the bone marrow. Imagine walking up a flight of stairs and feeling winded, even though you used to climb them effortlessly. That's what many of my patients experience. It's a reminder of how essential our kidneys are, not just for filtering waste, but for maintaining our overall vitality. If you notice persistent shortness of breath, especially if it worsens when you lie down, it's crucial to seek medical attention. This symptom could indicate that your kidneys are struggling and might need support. Sign 2. Feeling cold in warm environments. Have you ever felt cold even when others around you seem perfectly comfortable? This sensation can be more than just a quirky personal trait. It could be a sign of kidney disease. Feeling cold, especially in warm environments, often results from anemia. Anemia linked to kidney disease is particularly troubling because it means your kidneys aren't producing enough erythropoietin, leading to fewer red blood cells and less oxygen circulating in your body. Take, for example, Mr. Tran, a longtime patient who frequently complained about feeling cold. He bundled up even during summer days. After running some tests, we identified that his anemia was due to chronic kidney disease. With appropriate treatment, including iron supplements and erythropoietin injections, his condition improved, and he no longer needed to wear layers of clothing indoors. Feeling cold can significantly impact your daily life. Imagine trying to focus on work or enjoy time with your family when you're constantly shivering. It's a distraction and can affect your quality of life. If you find yourself frequently cold, it might be worth discussing with your doctor, who can check for underlying conditions like kidney disease. Additionally, I recall my own experience during medical training when I encountered a patient with similar symptoms. She felt cold all the time, and her blood tests revealed severe anemia. Treating her kidney condition alleviated the anemia, and she finally felt warm again. This experience reinforced the importance of considering kidney function when diagnosing anemia and related symptoms. Sign 3. Fatigue. We all feel tired from time to time, but persistent, unexplained fatigue can be a red flag for kidney disease. Kidneys are responsible for filtering out toxins from our bloodstream. When they fail to do so, these toxins build up, leading to feelings of tiredness, weakness, and difficulty concentrating. Consider Mrs. Liu, a teacher who found herself constantly exhausted, unable to keep up with her students. She initially blamed it on her busy schedule, but the fatigue became overwhelming. Blood tests revealed her kidney function was significantly impaired. After starting on a treatment plan, including lifestyle changes and medication, she regained her energy and could return to her active lifestyle. Fatigue from kidney disease is not just about feeling tired. It often comes with dizziness and an inability to focus, making it hard to perform daily tasks. For those with CKD, the reduced production of erythropoietin means fewer red blood cells, which translates to less oxygen and more fatigue. This condition, known as anemia, can be debilitating. Personally, I recall a period when I was preparing for my medical exams. Despite adequate rest, I felt unusually fatigued and had difficulty concentrating. Though it turned out to be due to stress and not a medical condition, it gave me a small glimpse into what my patients with CKD experience daily. It emphasized the importance of addressing fatigue comprehensively, considering both physical and mental health. If you find yourself feeling constantly fatigued without a clear reason, it's essential to consult with a healthcare provider. Identifying the root cause can lead to appropriate interventions, whether it's adjusting your diet, addressing anemia, or managing kidney disease directly. Sign 4. Trouble sleeping. Good sleep is essential for overall health, but kidney disease can disrupt this crucial aspect of our lives. When kidneys aren't functioning properly, toxins remain in the bloodstream rather than being filtered out. This can lead to insomnia or other sleep disturbances. For example, Mrs. Pham struggled with sleep apnea, a condition where breathing repeatedly stops and starts during sleep. This not only prevented her from getting restful sleep, but also exacerbated her kidney issues. Once diagnosed with CKD, her treatment plan included managing sleep apnea, which significantly improved her sleep quality and overall health. Sleep disturbances are particularly concerning because they create a vicious cycle. Poor sleep can worsen kidney function, and impaired kidneys can disrupt sleep. Additionally, conditions like restless leg syndrome and sleep apnea are more common among those with kidney disease, further complicating their sleep patterns. Reflecting on my practice, I recall a time when I had severe insomnia during a particularly stressful period. Although it was temporary and stress-related, it gave me insight into how chronic sleep problems can affect one's daily life. Patients with CKD often face long-term sleep issues, which makes managing their condition even more challenging. If you're experiencing trouble sleeping, especially if you suspect it might be related to kidney health, it's vital to seek medical advice. Proper diagnosis and treatment can significantly improve your sleep quality and overall well-being. Sign 5. Foamy or bloody urine. Changes in urine, such as foamy or bloody appearance, are alarming signs that should not be ignored. Foamy urine often indicates the presence of protein, a condition known as proteinuria, which suggests that your kidneys are not filtering properly. Bloody urine, or hematuria, can indicate infections, stones, or more severe kidney damage. I remember a young man, Mr. Vu, who came to the clinic with foamy urine. Initially, he wasn't too concerned, attributing it to dehydration. However, tests revealed significant protein in his urine, a clear sign of kidney damage. Early intervention helped manage his condition and prevent further damage. Blood in the urine is particularly worrisome. For instance, Mrs. Hein experienced this symptom and thought it was related to her menstrual cycle. However, persistent hematuria led to a diagnosis of kidney stones. After treatment, her urine returned to normal, and she avoided potential complications. From personal experience, I once noticed foamy urine after a long run. Concerned, I hydrated well and observed my condition. It returned to normal, but it reminded me of the importance of not dismissing such signs, especially if they persist. If you notice changes in your urine, such as foaminess or blood, it's crucial to consult a healthcare provider promptly. Early diagnosis can prevent severe complications and ensure proper kidney function. Sign 6. Dry and itchy skin. Dry and itchy skin can be more than a minor annoyance. It might be a sign of kidney disease. Kidneys play a vital role in maintaining the right balance of minerals and nutrients in your blood. When they fail, this balance is disrupted, leading to various skin problems. For example, Mrs. Lai came in with severe dry skin and persistent itching. Initially, she used over-the-counter creams without relief. Upon testing, we discovered her kidney function was compromised, leading to a buildup of toxins causing her skin issues. Treatment for her kidneys alleviated the skin symptoms. Dry, itchy skin affects quality of life significantly. It can disrupt sleep and make daily activities uncomfortable. This symptom often signals that the kidneys are not maintaining the necessary balance of minerals, particularly calcium and phosphorus, in the blood. Reflecting on my career, I recall a time when I experienced severe skin dryness during a harsh winter. It was uncomfortable and distracting, even with moisturizers. For patients with CKD, this sensation can be a constant issue, highlighting the need for comprehensive care. If you suffer from persistent dry and itchy skin, especially if accompanied by other symptoms, consult a healthcare professional. Addressing the root cause, such as kidney issues, can provide significant relief. Sign 7. Changes in urination. Our kidneys are crucial for producing urine, and any changes in urination patterns can indicate kidney problems. Frequent urination, particularly at night, can be a sign of kidney disease. Conversely, a decrease in urine output can also signal trouble. Consider Mr. Hugh, who noticed he was getting up several times a night to urinate. Initially, he thought it was just due to aging. However, tests revealed early-stage kidney disease. Early intervention helped manage his condition and improve his quality of life. Changes in urination are particularly concerning because they directly reflect kidney function. Increased urination, especially with pain or a burning sensation, might indicate an infection or other issues. A decrease in urine output can be even more troubling, signaling that the kidneys are not filtering waste properly. Personally, I remember a period when I had to frequently urinate at night due to increased fluid intake. Although temporary, it reminded me how disruptive and concerning such changes can be. For those with kidney disease, these symptoms are a constant challenge. If you notice changes in your urination patterns, it's essential to seek medical advice. Early diagnosis can help manage the underlying condition and prevent complications. Sign 8. Bad breath and metallic taste. Have you ever noticed a persistent metallic taste or bad breath that doesn't go away with brushing? These could be signs of kidney disease. When kidneys fail to filter out toxins, they can build up in the bloodstream and cause these symptoms. Take, for example, Mr. Huang, who constantly complained of a metallic taste and bad breath. Initially, he attributed it to dental issues, but further examination revealed advanced kidney disease. Treating his kidney condition helped improve his oral symptoms. Bad breath and a metallic taste can significantly impact your life, affecting your self-confidence and social interactions. These symptoms often occur because of a buildup of urea in the blood, which breaks down to form ammonia and causes a foul smell and taste. From personal experience, I recall a time when I had a metallic taste after taking certain medications. It was unpleasant and persistent, even with good oral hygiene. For patients with CKD, this sensation can be a daily struggle, highlighting the importance of proper diagnosis and treatment. If you experience persistent bad breath or a metallic taste, especially if accompanied by other symptoms, consult a healthcare provider. These signs can indicate underlying kidney issues that need addressing. Sign 9. Puffiness around the eyes. Puffiness around the eyes can be a subtle but significant sign of kidney disease. This symptom often indicates that your kidneys are leaking protein into your urine, a condition known as proteinuria. For instance, Mrs. Lan noticed persistent puffiness around her eyes. She initially attributed it to lack of sleep, but tests revealed she had nephrotic syndrome, a condition where the kidneys leak large amounts of protein into the urine. Early treatment helped manage her condition and reduce the puffiness. Puffiness around the eyes can significantly affect one's appearance and self-esteem. It's a sign that the kidneys are not functioning properly, leading to fluid retention and protein loss. This symptom is particularly concerning because it often goes unnoticed until it becomes severe. Reflecting on my practice, I recall a patient, Mr. Pham, who had noticeable eye puffiness. Initially dismissing it as a minor issue, further tests revealed significant kidney damage. Addressing his kidney health helped reduce the puffiness and prevent further complications. If you notice persistent puffiness around your eyes, it's crucial to seek medical advice. Early diagnosis and treatment can prevent severe kidney damage and improve your overall health. Sign 10. Swollen ankles, feet, or hands. Swelling in the ankles, feet or hands is a common sign of kidney disease. When kidneys fail to remove excess fluid, it accumulates in the body, leading to swelling. This condition, known as edema, can be uncomfortable and even painful. Consider Mr. Bin, who came in with swollen ankles and feet. He initially thought it was due to standing for long hours at work. However, tests revealed he had chronic kidney disease. Managing his condition and reducing fluid retention helped alleviate the swelling. Swelling can significantly impact your daily life, making it difficult to wear shoes, walk, or perform routine activities. It's a sign that your kidneys are not functioning properly, leading to fluid buildup and increased pressure on the body. Personally, I remember experiencing mild swelling after a long flight due to prolonged sitting. It was uncomfortable and concerning, even though it was temporary. For patients with CKD, this symptom can be a constant issue, emphasizing the need for comprehensive care. If you notice swelling in your ankles, feet, or hands, especially if it persists, consult a healthcare provider. Early diagnosis and treatment can help manage the underlying condition and improve your quality of life. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment "Great" to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. By understanding these signs and taking preventive measures, you can protect your kidney health and overall well-being. Early detection and proactive care are crucial for maintaining healthy kidneys.